We're joined from Gaza by the director of the Medical Relief Association in the Gaza Strip, Bassam Zaqout. Mr. Bassam, thank you so much for joining us on Qnews. And I would like to start with the forced evacuation of the Indonesian hospital in Beit Lahia. What are the immediate humanitarian implications of this?
Indonesian hospital is one of the three hospitals currently under Israeli attacks in the northern part of the Gaza Strip. Yesterday, they evacuated in the night. They evacuated most of the patients and the staff. I think there is remaining one or two doctors inside the hospital, but it's completely not functioning now. The left part of Gaza Strip, it's now the left without health services, mainly hospitals. The three hospitals under attack, and there is no access granted to the three hospitals because they are surrounded by Israeli tanks. Even mostly the Kamal Udwan, the surrounding area, even most of houses has been cleared up from this, and this is intensified in the last
Yes,
week.
Mr. Bassam, in light of the intensifying bombing on the healthcare sector in Gaza, how's the targeting of health facilities like Kamal Udwan and Al Auda hospitals affecting Gaza's already struggling healthcare system?
Yes, it's a peak of a crisis. Deterioration of healthcare system is ongoing day by day by the forced attack by the Israeli side. I think they are trying to demolish to the zero all the health services in the north, and there is a plan to turn it into a buffer zone. Or they opened the appetite for the Israeli settlers to come and settle in the north part of the Gaza. The health services is, sorry, please.
Now, sir, regarding the Israeli occupation forces obstructing the work of the aid workers, if you can shed light on the challenges faced by the humanitarian aid workers in Gaza, especially under the ongoing siege.
Yes. Well, for you to know, it's more than 1,150 of health personnel have been died during this war. Also, there is more than 300 of health workers still in the Israeli arrest. And there is a forced evacuation of some health doctors from one area to other area. All these implications make the health workers feeling that they are unsafe all the time, so they are working in a very difficult mental conditions and mental status that they have. This is have implication in their functioning in their daily regime, as they are every day seeing that most very difficult injured.
Now, sir, what role should international organizations, especially such as UNRWA, play in mitigating the humanitarian crisis in Gaza?
There is different action they can do. First, they can bring health missions to Gaza to help the deteriorated healthcare system and to come back with some, at least, services. They can also invest in bringing some medications, equipments, or field hospitals to fill the gaps in the health services from the attacked or destroyed hospitals. Already 23 hospitals has been destroyed in Gaza, and they are not functioning. But the main problem is the health staff and the resources, and this is the two things that they can do. But also this need even Israeli permission to do that, and without the Israeli permission, they cannot bring people inside Gaza.
Now, regarding the impact of this on children, how can the international community address the alarming statistics of child fatalities and the psychological trauma reported in Gaza?
This is a very difficult case. I don't think that without reaching a ceasefire agreement that the situation of the children can be changed. There is a lot of starvations among all the children, acute malnutrition, and even famine in most of the children. And currently I can state that there is no one children in Gaza not having a disease. from infections, upper respiratory tract infection, or diarrhea, or gastroenteritis, or different conditions related to the bad environment, bad hygiene, and the overcrowdedness system. So cannot be easy replaced unless there is a ceasefire, so we can do some replans to reach the children. I think also there is a part of the children in Gaza Strip, they are living in not a humanitarian area. They don't have access to the hospitals or primary health care facilities, and they are due to unsafe movements, so they might يعني dying in their houses silently. There is increase in morbidity and there is increase in mortality. And recent reports, there is increase in infant mortality rate and neonatal mortality rate due to lack of oxygen, lack of incubators, or lack of resources, even in the hospitals.
That was the director of the Medical Relief Association in the Gaza Strip, Bassam Zaqout. Thank you so much for your insights and for all the information you provided us with.